the nice thing about the test results, you get targeted information, and then you can customize with metabolic maintenance products. You can customize the formulas so it can be a simple shot for the patients and help with compliance and treatment and help them get better. And we see it. I see it every single day. Patients getting better.
I had a multiple sclerosis patient on Neurontin with lower extremity pain, and she just wasn't getting any relief from it at all, and I started her on alpha lipoic acid, and within 2 months she was off her Neurontin and no pain in her legs.
That's wonderful. That's great.
It was really great.
Well, good. Thank you.
You're welcome.
We're at a very exciting place here with medicine because everything now is about customization, personalization, and there's no better place to start than nutrition. All of these functional tests now are allowing us to perfectly personalize someone's nutrition to their biochemistry. Now for the doctor, that also gives you a huge advantage out there in the marketplace, a great competitive advantage, because no longer can people go to the health food store and pick and choose when they're working with you and they're getting things customized and then compounded exactly for them. So this really is going to be the way that you can get better results, you'll get better word of mouth referrals, and you'll get residual income as well.
One case that particularly stuck out of my mind regarding amino acids was a case of a 16-year-old girl who actually happened to be a friend of mine, but she had serious rage issues, and it was affecting her family life, her social life. She was getting into trouble, and she just couldn't even stand in her own skin. She just had this massive rage issues, and so her parents came to us and said, "Help! Can you help our daughter? She needs something. The doctors don't know what to do with her. Give her sedatives, help her with, just calm her down with the drugs that they had, and those weren't the answers that they wanted." So we ran the amino acid test on her, and she had several imbalances, pretty much amino acid deficiency across the board, with some specific ones even more lower. The ones related to neurotransmitters, tryptophan and phenylalanine, were on the low side for her. And so we got the customized formulated blend based on the test results. And she turned around within like 2 weeks. It was a miraculous turnaround. And so she was so dedicated to taking that because she knew how much it impacted her life that she didn't even bother. The amino acids aren't the best tasting thing, but she didn't even bother wanting to mix it up with anything. She just wanted to get it in her, so she would just take it by the spoonful and put it in her mouth because she knew that it made her sane. This stuff helped make her sane. And so she loves the stuff, and she's still on it.
Functional medicine is the future of medicine, literally. It is looking at the cause of the problem, which is really important, as opposed to just treating the symptoms and putting a Band-Aid on the problem.
Because of my exposure to the IFM, it's really helped me be able to help patients see the connections between these different conditions. And I can say, again, on a very regular basis, after my first office visit with the patient, 60 minutes later, the patient is saying, not one doctor in my life, in the last 50 years of my life, after dozens of different kinds of doctors, chiropractors, medical doctors, all different kinds, no one has ever shown me these connections between my gut and my back or my neck. And to me, that's as powerful as anything. It's remarkable, and these people leave with a much greater sense of hope and connection and understanding, and partly obviously because now they're not trying to treat 10 different conditions that they have, but now they have a unified approach to how they're going to help themselves be well.
There's a couple of important trends which are, I think, going to support functional medicine and the functional medicine approach. One is that from the government down to community health centers, people are starting to recognize that we have got to start paying attention to prevention, and really prevention more than just screening for disease, but prevention in terms of preventing the occurrence of disease, and that ultimately is about functional medicine. That's working with people on their diet and their lifestyle, and so I think because there's finally some serious sort of awakening to the importance of prevention, there's a lot of potential for functional medicine to step into the mainstream in a much more relevant way.
The challenges of functional medicine today are many, but the opportunities are even greater. And what I see is America heading over Niagara Falls with a $2.4 trillion a year healthcare budget that we can't pay, we can't afford, and it's a disease paradigm find one isolated ingredient, then a drug, use that for one ICD-9 billing code and call it a day. Well, now we find that that doesn't work very well for diabetes, cancer, autoimmune diseases. So functional medicine is moving in the right direction, and there's a great deal of work yet to be done. And I guess the time will come eventually, whether we like it or not, when we'll have to embrace this school of thought that you are what you eat. The human body is made up of environmental toxins and things that we think and drink and breathe and move, and so it's a complex movement of parts that determines whether we have health or illness and which illness we get. And what functional medicine is talking about is, what is that biochemistry? How can we affect it in a positive way? It's a wonderful story, and there are many challenges ahead.
We have the right medicine, the right philosophy of healing, talented individuals in the profession, a lot of passion for what we do, so we've got all the right ingredients in place to grow. We just need to get the growth stimulated.
In the allopathic realms, and we're focusing more on pharmacologic treatments like the hammer on the cancer as opposed to looking at the base of what's brought that cancer to fruition. So we're looking at the underlying cause of the issue.
Well, what's unique about this conference is, first of all, it was put together by a committee of primary care doctors, primary care practitioners, doctors in the sense that they're practitioners. And so we have a committee of across the board in terms of primary care healthcare providers, and that includes MDs, DOs, DCs, et cetera, et cetera. And we asked them the question, what do you need in your clinics the most? And they needed information about how to really deal with cancer. Because in conventional medicine, when you make the diagnosis of cancer, you send the patient off to the oncologist and they come back with only at the end of that therapy. And then you start dealing with primary care issues again. And our research and our primary care base said we want a program that helps us, first of all, really look at primary prevention, because we have patients that come to us and say, I have a family history of cancer, I'm worried about my own risk, so you help them stratify that risk. And then you start a program that's personalized to their genetic, personalized needs in terms of that family history and those genetics. That's primary prevention. Then when a diagnosis is made, there's a real issue now in the literature that primary care doctors desert their patients because there's this hierarchy with oncologists that we'll let you know when we're done. And being done can be too well done. You need someone to help you be robust as they get you done. And then survivorship. If you really look at what oncologists do with survivorship, they have you come back at 3, 6, 1 year, 2 years, and on down. They're not doing survivorship. They're looking to see if their therapy failed. Do you have cancer again? Survivorship is about how do you reduce the risk of a recurrence of cancer. And with many oncology agents, including radiation, you have a higher risk of a new cancer. Someone needs to be stratifying you for that risk and helping you develop a robust system that can handle that risk. And this conference was marketed in such a way that they knew that we were going to address those issues. And I don't know of any other conference that really looks at those 3 issues: primary prevention, stratification, adjunctive therapy to stay robust while you're getting well done, and survivorship.
This conference is unique in that they are really focusing on the functional medicine aspect of cancer. And that's an important kind of slice of the pie. I think that it's very important that when we're looking at the disease of cancer, we recognize that it's very much about the disease itself, but also the person in whose body this disease is growing. So I think this conference is addressing that component of the disease, and I don't know that it's really addressed to this depth and at this intensity anywhere else.
My impression of what's going on here is that it's very well done and it's long past due. America started the war on cancer with Richard Nixon in 1972, in which case he claimed within 5 years we would have a cure for a major cancer. Well, we are now 40 years beyond, and we have spent about $60 billion in research, and over $1 trillion in therapies, and we have no cures for any cancers, and some of them are worse off than ever. And so we're long past due to discuss the subject of what causes cancer? What's the biochemical milieu of the body that leads to this abnormal uprising of a rebel cell that we call a neoplasm? And how does it spread and metastasize? The conference is wonderful. I hope that it will be embraced by the 10,000 oncologists in America, which would make even a bigger difference.